So, antisynthetase syndrome is a diagnosis that patients may be given. And it's basically a subcategory of inflammatory myositis. So in order to make sense of this, it probably would be helpful to take a step back and think about how healthcare providers classify myositis. So myositis literally means inflammation of the muscle. And a lot of different things can cause that. There are certain infections that can cause myositis, there are certain medications, and just simple trauma can cause myositis as well. However, when the myositis is due to an autoimmune process, meaning the immune system is attacking the muscle itself, we usually term that as an autoimmune myositis. And another way of saying that is an idiopathic inflammatory myositis. Idiopathic meaning we don't know the exact cause. So once you have that term, that idiopathic inflammatory myositis, under that, to make it a little more complicated, there are additional diagnoses, and that's when you have polymyositis, dermatomyositis, and what we're talking about today, which is the antisynthetase syndrome. The reason this is important, and you want to know kind of which box a patient fits in, is because healthcare providers think about that patient a little differently depending on where they are. Okay, so for the remainder of this video, we'll be talking about antisynthetase syndrome. Antisynthetase syndrome, similar to other inflammatory myopathies, has an average onset of about 50 years of age. It can affect men as well as women. And it's very heterogeneous, meaning it can present with a lot of different symptoms. The way it's usually diagnosed is a patient will have something called a myositis-specific antibody. There are many. The most common is something called JO1. But there are several, and it kind of sounds like alphabet soup to say them. There's PL7, there's PL12, OJ, EJ, the list goes on and on. This is usually a blood test that the healthcare provider will order. So once they have one of these autoantibodies in the blood, they'll also, of course, have certain symptoms. Those may be related to muscle weakness, difficulty getting out of a chair, going up the stairs, lifting their arms above their head. It can also involve the lungs. Patients can have difficulty breathing in a condition called interstitial lung disease, when the lungs can kind of be a little fibrosed and hardened. And they can also have a lot of joint pathology, meaning their joints can have the inflammation, swelling, redness, and pain. So usually two of those symptoms, the muscles, the lungs, or the joints, are present in addition to the myositis antibody that I mentioned earlier. And that typically is how this syndrome is diagnosed. Oftentimes patients will have other symptoms as well. Those can be Raynaud's, which is when the fingers change color in response to cold or stress. There's also something called mechanic's hands, where the skin of the hands can appear very rough, as you might imagine a mechanic's hands might actually look like, or just high fevers.